Welcome to Health Matters with Dr. Nelson Bulmash, sponsored by the UI Radio Network at uiradionetwork.org. Catch us on Facebook and Instagram at United Intentions and Twitter at Higher Intention. Look for us on 99.1 FM, iTunes, iHeartRadio, Spreaker, Stitcher, Blog Talk Radio, and many more. Over the next hour, we'll introduce you to some fascinating people and engaging discussions that may provide you with answers to assist in revolutionizing your own personal health. And now, here's Dr. Nelson.
Hi, I'm Dr. Nelson Bulmash, the host of Health Matters on the UI Media Network. Before we jump into the interview today, I want to thank all those who are listening to me locally on Talk 10 FM and WDJY FM 99.1. And from our new friends who are catching the show up in Ohio and Kentucky on WTTA 101.2 FM, thank you and welcome. And for the rest of you wonderful people who are listening to us on all the major social media platforms like Blog Talk, iHeartRadio, Facebook Live, and others, it's a pleasure. We really, really appreciate. And I say we because I have my friend, Dr. Amy Darius, who has her own show. We're going to talk about that shortly as well as interview her. So we really appreciate you listening to us. And we also appreciate you sharing our show. And we know that you've done that because our analytics prove it. So thank you. Great to be with you today. So, Amy, I know you're very excited. And
I'm
I am
so
too.
excited. Thank you for having me on your show.
You're so
This
welcome.
is fun.
Yeah, thank you. We're going to have a great time.
Yeah.
Before we jump in, folks, as I mentioned, I have a few messages that I want to share with you. The first is that my show, Health Matters, is dedicated to discussing the very best of health, inspiration, and spirituality. As a result of that, I've picked an amazing colleague of mine here and friend, and we're going to talk about how your oral health determines to a very great extent your systemic or bodily health. So hang on there. We got some really exciting things to talk about today. If you're catching the show anywhere in the world, make sure that you share it with your friends. We grow because you share it, and we're going to change your life one conscious intention at a time. So thank you for joining us, and thank you for sharing our show. All right, if you have any questions, feel free to tune in to Facebook Live and go to United Intentions, and you're welcome to submit your questions there. Or if you'd rather call in, you're welcome to do so. The phone number for a call-in line is 678-495-4345. Again, that's 678-495-4345. Okay, listen, we'd love to connect with you. That's right. And we're going to connect with you today, but we'd love for you to connect with us online on many of the social media platforms. So if you'd like to do so, you can connect with us on Facebook, Instagram, and YouTube. We're under United Intentions. Or if you go to Twitter, we're under Higher Intentions. And if you'd like to connect with me specifically, I'm on LinkedIn, Instagram, and Facebook. And you can look me up under Dr. Nelson Bulmash. Love to connect further with you. Also, UI Media Network is now offering a host of advertising services, even if your budget is limited. So if you want your business to grow, call us. Once again, same number, 678-495-4345. And learn more about our April specials for your own commercial and how that can assist you in growing your own business. Now, 2 shows ago, I made a big announcement, and I'm going to bring it to your attention again because we now have people listening to our shows all over the world. I mentioned to you that we're on Binge Networks TV. And if you want to find us, all you have to do is go to bingenetworks.tv. Look us up under UI TV. We're on channel 12783. We are growing very rapidly. And one of the reasons it's so important to support us is because we are doing everything we can to change your life and the lives of your friends and family members, one conscious intention at a time. And we do so through our shows. So thank you so much for your support. Dr. Darius, it's a pleasure.
Thank you so much for having me. I'm so excited to be here.
Yeah, you bet. So you are an integrative dentist in the Roswell, Georgia area.
Yes. I've been practicing for 23 years. This is my hometown. Grew up here. See a lot of friends and family from my childhood as well as current community, people I meet in the community.
Yeah, absolutely.
And you mentioned integrative. I completed an integrative medicine fellowship a little over a year ago. It's a 2-year program.
Right.
Prior to that, I did an 18-month-long herbal medicine program for healthcare practitioners. And these are elements that I've brought into my practice And that's what makes me integrative.
I
So
love that. I love it.
integrative isn't really quite its own like denomination, so to speak, in
Yes.
dentistry, where you might have an oral surgeon or a periodontist.
Right.
But through additional education I've gotten outside of the typical dental school education,
Perfect.
it's what I've made up as a thing.
Yes, I like that, and thank you for the distinction, because what I really want to do is I want to initially, and by the way, I'm holding back. I was going to go into your book first, but you took me on a little different path. We're going to take a turn, and we're going to talk about that, and then we're going to go to your book.
Okay.
Okay. I'm very excited about that
Thank
and your
you.
contribution to the world. So, I think probably most people, Amy, have an understanding of dentistry, that dentists look at your teeth, they evaluate for cavities and any other damage maybe done to your teeth, or bite issues, gum issues, and maybe an occasional probably issue with an oral cancer or something like that.
Sure.
So I love the idea that you're into integrative dentistry, because I think that we're all kind of sitting back and going, we probably have the best emergency care in the world. Our emergency care in Western medicine is fantastic, but I think a lot of us are stepping back, and I don't want to be rude to anybody who's more traditional or conventional in their approach, but I think we're all recognizing that we need to start focusing more holistically, or in a more integrative fashion, on the patients that we see,
Yes.
right? Yes. And so what is different about an integrative dentist versus a more conventional, traditional dentist?
When you come see somebody like myself, we're going to be looking at not just your mouth, and your mouth is a standalone body part that's apart from everything else, but about 90% of systemic diseases or conditions, there's going to be some sort of oral symptom or sign in the mouth of that condition. It's a part to a whole.
Right.
And recognizing what the mouth part might be indicating about the whole body.
Excellent. So it's interesting you say that, because you hear countless doctors currently. I don't care if they're naturopaths, medical doctors, PhDs, who specialize in immunology, biochemistry, microbiology, all talking about the gut. And one of the things that
Yes.
I've said for many, many years, Amy, is I get it. I get the gut's important, but if you have problems in your mouth, it's going sideways before the food ever get, or beverages ever get to your gut.
And there's so many reasons for that. So we could start first about just talking about the bacteria.
Right. Let's do it.
So like 45 to 50% of the bacteria in the colon is shared by the bacteria, or it's the same bacteria as what's in the mouth.
Right.
There have been medical studies done on people that have passed away from heart attacks, and about 50% of the time, bacteria is found in those autopsied samples that really was attributed to being able to cause a cavity in a tooth.
Wow.
There's different statistics rate, but maybe between a third and 75% of those patients who died of a heart attack had bacteria that caused gum disease. So we're seeing that what's in the mouth is going to flow everywhere else.
Absolutely.
Throughout the body. And then when you talk about in the gut having somewhere between 70 and 90% of your immune system cells in your gut, and then you look at the bacteria that are going to influence how the gut's going to function. Is it functioning in a compromised fashion or in a whole fashion, and how that's going to upregulate or downregulate your ability to fight off different types of problems. You start really appreciating how the mouth bacteria really might be implicated in gut bacteria and everything else, in terms of wherever you might have bacteria in your heart valves,
Yes.
in
Love
your
that.
sinuses, anywhere else.
And I want to focus on that for just a second, because once again, we're focusing so much on the intestinal tract and not enough on where digestion actually starts, which is the mouth. Read
Yes.
a really interesting book on, I think it was called How to Beat the Heart Attack Gene. Have you read that?
I have not read that book. I've read a lot of other books I love to read.
Amy, fantastic book. And one of the points they make is that they found I think it was 5 specific organisms that are critical. In other words, that you want to make sure you take care of, because
Yes.
not only do they cause plaquing in the mouth on the teeth, but they also cause plaquing of the coronary arteries.
Well, that makes sense. And the other thing is, if we're breathing through our mouth, we're not breathing through our nose, and that's going to alter the nitric oxide level that we're able to make.
Very
So
good point.
Nitric oxide's a gas that we have to constantly make.
Right.
Nitric oxide has about 7 functions in the body, including the regeneration. It's responsible for us being able to regenerate the inside of our blood vessels, the endothelial tissue.
Yes.
It's responsible for apoptosis, which is cell death when it's appropriate. So when we breathe through our mouth, we change the bacteria in our mouth. When we don't eat well, so we don't have nitrates types of food like what might be
Sure.
found in green leafy spinach coming into our mouth. We can't transfer that or convert that starting in the mouth to nitrates, which enable us to then make nitric oxide. So what we put in our mouth is actually really critical, or what we don't put in our mouth in
Mouth,
terms of
yes.
not breathing through our mouth,
Right.
because we need these types of bacteria that are going to be able to convert this nitrate to nitrite to then therefore make nitric oxide.
Right.
So, and also this is, I think this is
Did you
simple.
think you could have so much fun talking about mouth bacteria?
I don't
Be
know.
honest.
It's fun for me.
I know. I love it. I love it. Continue, please.
So, if you have an autoimmune disease, for instance, Sjogren's syndrome, which is like dry mouth, dry eyes, mostly it's like a middle-aged woman sort of thing.
Right.
But it's heavily associated with overall autoimmune problems. And in this nitric oxide pathway, so about 25% of your nitric oxide ability starts in your mouth. Another 20 to 25% is in your stomach. So if you're taking like a proton pump inhibitor, stuff that's going to alter your acid ability making level in your mouth or your stomach, then you're maybe cutting out half of your body's ability to make this very important gas.
Wow,
But then
wow.
if you have Sjogren's or an autoimmune issue, that actually gets circulated back to your salivary glands. And if you have Sjogren's or an autoimmune problem, you cannot then make even more of your nitric oxide. So it's a very
Vicious
interesting
circle.
yeah,
Yes.
cycle
yes.
that just repeats. And then there's drugs like proton pump inhibitors, PPIs, and also mouthwashes will actually affect your ability to make nitric oxide.
Well, let's talk about that for just a second, because a whole lot of people use mouthwashes.
Yeah.
What's the story? Should we not use mouthwashes, or are there
So,
specific mouthwashes?
There was a
that-
study done several years ago. Duke University was part of the study,
right.
and they tested people's ability to make nitric oxide up to 6 hours after being exposed to various types of mouthwashes. So some of the mouthwashes were prescription strength that you might only get at your dentist.
Right.
Some of them were over the counter. In the study, they named different brands that they used, and they went on down to water. What if you just rinse with water? So water had the most minimal impact on
Sure.
your body's ability to make nitric oxide. But the prescription mouthwashes and then the over-the-counter ones that were alcohol or phenol-based, chemical-based mouthwashes had an effect up to 6 hours after. So
Wow.
if you have somebody with heart disease or diabetes, these chronic inflammatory conditions, perpetually using these kinds of chemicals, they are actually inadvertently creating a worse situation for
By
their
creating a
overall health.
bacterial imbalance in the mouth.
Right, because it's
Oh, okay.
killing indiscriminately all types of bacteria,
Right.
these antibacterial mouthwashes.
So it brings to mind another question, which is, it sounds like we have to have what I'm going to call good bacteria in the mouth.
Yes,
Talk
we
about
need
that a
to
little
talk
bit.
about not eradicating all bacteria in the mouth,
Right.
because something is going to live inside you. So for every one human cell, you have 10 bacterial cells living
Wow.
in you.
Okay.
So you just want a better balance. I often liken it when I'm talking with patients about this
Yes.
to, let's say you're developing a neighborhood,
Right.
and you want the neighborhood to appeal to families with young children.
Okay.
So if you're that neighborhood developer, you might have an elementary school located very close to your neighborhood, and
Right.
maybe a wonderful playground and a swimming pool. And then you can just already imagine, if you're a prospective homeowner coming into the neighborhood, how the school bus is going to let out all these kids and they're going to go off to the pool if it's a hot summer day. I mean, because you've attracted the right environment to attract these types of families.
Sure. Makes sense.
So you want to, through diet and other conditions like encouraging breathing through your nose, which we can talk more about later, we want to encourage the right environment so you have the right type of bacteria. It's just certain strains that cause cavities. It's just certain strains
Yes.
that are responsible for periodontal problems, and these are anaerobic types of
Right.
bacteria.
Which is interesting, because as I remember, they said 5 different strains that were specific to creating problems directly with the arteries of the heart.
Yes.
So we've got about another minute. I want to start this. I mean, before we take a break, what are some of the things you can do to cultivate healthy bacteria in the mouth?
I'd recommend eating maybe an anti-inflammatory diet. Some people refer to that as a DASH, dietary approaches to stop hypertension, or Mediterranean type diet. Low glycemic type foods that
Right.
are lower in sugar. They're not going to spike your insulin level. These are supportive. Green leafy vegetables
Okay.
But then there's also some gene SNPs and some other factors that can influence. You have two people that eat the same diet and they could still look very different.
Right.
So we could talk about that maybe
Fantastic.
when we come back.
We will. Folks, I'm Dr. Nelson Bulmash. You're listening to Health Matters, and my guest is Dr. Amy Daries. We're looking at how your mouth dramatically affects your health.
Confidence. That's the key to unlock the door to unlimited speaking opportunities. The question is, do you have it? The answer is yes. But where to find it? Entrepreneur and public speaker Mark Stephen Pooler designed the Brilliant Speaker program to give you the blueprint to build confidence and become a genius entrepreneur and successful public speaker. In his 3-hour workshop, one-to-one or group coaching programs, you'll learn proven techniques, tools, and mindset development skills to help your career, business, or team to blast off into success. And to commemorate the launch of this phenomenal program, he'll be giving away a signed copy of his book, Tips to Create the Life You Desire, and a 1-hour coaching session. Simply visit www.markstephenpooler.com. That's Mark, STEPHEN, Pooler.com. Press Yes, I want to move forward, and type WIN to claim your gifts and your new opportunities with the Brilliant Speaker program. Don't miss out on this once-in-a-lifetime opportunity to get more speaking gigs, bring in more money, and create the life you truly desire. Confidence is everything. Don't be left with nothing.
Hi, ladies and gentlemen. Dr. Nelson Bulmash here. You're listening to another episode of Health Matters, and my guest is Dr. Amy Daries. Sorry about that. My mic went out for a second, and I couldn't hear myself, and nor could you hear me. So I'm back. Amy, I've got to talk to you about your book. I'm so excited about it. It's such an achievement.
Thank you. I'm still working on it. It's the title is actually amazingly, I thought it would be the first thing I would think of and really commit to, and it might be the last thing I finally commit to. But it's finished. It's in the editing process. It should be out. It's up for Amazon pre-order right now, but the title may change. You could just look up my name on Amazon, I guess, if you want to pre-order it. But
that's Dr. Amy Daries.
It'll be out on June 6th. And right now, the title might just be The Core of the Snore, Solving Sleep Disorders for Better Health.
Amy and I are laughing because here she wrote what I'm sure is going to be a tremendous book. She's very gifted in that way, and she can't find a title for the book, which is understandable. I've heard lots of authors say the same thing, like, I wrote my whole book, and yet I can't come up with a title that I like. So we were laughing before the show got started. We were trying to come up with titles, so she was writing down all these possibilities for titles. So, Amy, you let me know when that comes, and I want to make sure I interview you again, and I want to show your book on one of my shows and talk about it to support you, okay?
Thank you.
You're very, very welcome. So let's get back. We were talking about the importance of healthy bacteria and what we can do to make sure that we have lots of good bacteria in the mouth that support our teeth and our gums and health in general in our oral cavity.
So I agree that with the concept you are what you eat. And so you really want to be very careful and aware of the sugar content in your food. I like that glycemic index is sort of one of the latest terms, or we've been using it for several years. But sometimes the temperature of your food could affect the glycemic index or what you might pair with that food. So, for example, rice is very, very high in glycemic index, and that means that it's going to spike your blood sugar level
very quickly, right?
Now, brown rice is not going to spike it as quickly or as much as like white rice. But if you paired that same white rice where it's cold and possibly like in a sushi sense where it's paired with some protein, it actually is going to spike your blood sugar level less than if it's hot, which is to me really fascinating that could even make a difference. But it's because it's cold and because it's paired potentially with like a protein, like a fish.
Yes.
So I would say, for those of you out there who are like to get on the internet, maybe Google images of like different food pyramids. And I mentioned the Mediterranean diet and the DASH diet, or just the anti-inflammatory diet. Right now, a lot of people talk about paleo
Yes.
diet, and I think paleo, if you're going to be a super strict paleo, that could be very hard to maintain over a long period of time. If somebody has with paleo, you're generally eating. The concept is you're eating things that caveman would have eaten.
Right.
Maybe a lot of raw types of vegetables and maybe some fruits and then some meats. But if you ate a lot of meats and you have a tendency towards like gout or your kidneys may not be as highly functioning, then that might be dumping or causing you to dump a lot of uric acid in your kidneys. So maybe just check with your doctor. And any of this stuff that we're talking about, you always want to check with your own personal doctor or physician or healthcare people.
And as she says that, excuse me, Amy, make sure you have a doctor who is functionally oriented, because sadly, a lot of the conventional doctors will look at you and not have really any idea of how to instruct you. So let's make sure they talk to somebody who's into functional medicine.
And who's going to give you the time, because this is in-depth stuff. It takes a long time for a lot of us. A lot of us aren't taught this, actually, unfortunately, currently in mainstream Western programs,
right.
And so it's helpful to mention those things.
Yeah, and that's why it's so important. And I just want to commend all the doctors of all kinds who are getting into a functional approach, getting into a holistic or an integrated approach. It's so much fun to, I say this very playfully, to play, if you will, in the sandbox with other healthcare professionals who are interested in a holistic approach, because everybody gets, we've got to look not under a microscope, under just teeth, just gums. We've gotten in some ways so specialized that we've lost the big picture, which is the holistic approach to taking care of people, which means, and by the way, I'm so impressed with you, because I've never had the privilege of hearing you expound on these matters, and you're so knowledgeable, and that's so wonderful, because I don't know that I've met many dentists who have an understanding, for example, of how to alter how you eat so it alters the internal milieu, the terrain, if you will, of the mouth, so we get a decrease in risk of heart attacks, or so we have more oral hygiene. That's wonderful. I'm so impressed.
You'll probably need less professional oral hygiene care if you're eating better and if you're paying attention to some of these parameters. So I know you initially asked me, what else can you do to change this flora in your mouth or in your body? So I also recommend to a lot of people, if they want to take something, maybe eating more fermented foods. We didn't touch on that. So fermented foods or probiotics.
So prebiotics are going to be the food that helps to actually feed the good bacteria.
Like sauerkraut or kimchi or some of my favorites.
Good fibers.
Yogurt, maybe with these active yeast and cultures, active yeast cultures. And then probiotics can be like a pill, but I tell people, if you're going to buy it, go ahead and eat it, take it. Because to me, it's sort of like when they bring it to market and they have on the label how many billions of this and billions of that are in there. It's like a bucket of worms. And so like, if you bought the bucket and now you put it in your refrigerator for several months, because I don't know, it's at your friend's fishing camp or something, and you go back later, you don't know how many worms are still in the bucket.
Yeah, how many are viable.
Right. So you want to just like eat it already or take it already. But even a few times a week is very helpful.
Well, thank you so much. This is so fascinating for me. I've never had the privilege of being able to speak to somebody who really understands oral hygiene. It's fantastic.
Thanks.
So let's pursue this a little bit more. So I think you said that the number was 45 different organisms are in the mouth that also have commonality.
About 45%.
Oh, 45%.
45%.
Okay.
So roughly half
of the
are going to be the
organisms
same. That are in the mouth. They're also going to be in your colon.
Wow.
So all the way down, all the way throughout your whole GI tract.
Got it. I want to talk about materials, anything you feel comfortable, because we
I'm happy to talk about materials.
Thank you. So Amy, we do a lot with materials, meaning sometimes we have to have restorations, sometimes people do veneers, sometimes people have to have cavities filled. Talk to me a little bit. I know there are great advancements. We have better materials now that are much safer, BPA free, for example.
Right. So I think you have,
about that
not at all. I think you have to kind of date our profession in terms of like what technology do we have today that we might not have had a few years ago or a few decades ago or even beyond that, before that. So there's a lot of concern in our industry about using amalgam filling material,
Right.
which is about half by molecular weight mercury.
Right.
It's also got copper, tin, zinc, but the primary other ingredient besides the mercury is silver. And silver traditionally was used as an antibacterial. You had, what do I want to say, colloidal silver, concoctions like herbally speaking.
Yes.
Or that's not an herb, but you understand what I'm
Yes,
saying.
I know, yeah.
Traditionally, in traditional old-fashioned sort of medicine. So these metals were mixed together, hence the word amalgam, which
right.
means mixture, and then it would sort of set. It's sort of like clay-like, and you would stuff it in a tooth, and it would sort of set. And it's still being taught here in our United States dental schools, but because we've been able to have an advent of other materials that are now super strong and have other actually wonderful properties, chemical or material properties.
Yes.
We really don't need to use that other stuff anymore.
Good.
But we still have a lot of people that walk around with these chemicals in their mouth,
Right.
and that is a great concern. And in some other parts of medicine, they're concerned, like from cardiology, they're saying maybe as much as like a third of people that have cardiology problems have heavy metal burdens that they might not be identifying.
Right.
So here in Fulton County a few years ago, so I'll go back to my own little history for a second.
Okay.
I found out a few years back I had lead and mercury poisoning. And I had a lot of maybe childhood hobbies or the environment I grew up in where I might have had some exposure. And then I have some genetic things that might make it where I don't detox as well as the next
Sure.
person. But then I have worked with those things in my dental
Career,
practice
right.
for decades now. And even though I haven't been placing amalgam fillings in decades, I take them out
Yes.
of people when they fail. Or I have people seek me out to have those taken out because they don't want that in their body. So I will get some exposure
Yeah,
when
makes sense.
I have that. So there are some different protocols a dentist can follow to try to cut down on the exposure in the office and for the patient and for the dentists themselves
Right.
when they take these out. So we follow those things. You said talk about different materials. That's one whole topic of materials. Another topic that's pretty controversial in my field is fluoride. Fluoride's a halide chemical. It's added to our municipal water supplies.
Right.
And the controversy is that it can impact your thyroid. And we have a lot of people here in our country that are hypoactive, or maybe they have Hashimoto's. They have thyroid issues.
Yes.
And fluoride could be a contributing factor or causative factor for that type of problem.
Right.
And why is that? And the reason why is because it's going to compete with iodine, which your thyroid needs, not just your thyroid, your breast tissue, your gonad tissue,
Sure.
prostate, uterine tissue, all needs thyroid. Also, the glial cells of your brain, when that's developing, it doesn't need fluoride, it needs iodine.
Iodine.
Excuse me.
That's okay.
So that's the concern. And we have so many places nowadays that we get exposed to fluoride. So in the last couple of decades, you can go back and see that some of the larger governing dental organizations like American Dental Association, we have reduced the amount of fluoride that's potentially recommended to people to use.
Right.
And I'm not going out and talking about we should be all this or all of that. I think that stirs up a lot of controversy. I think
Right.
what we really need to just talk about is where is the individual, and you could have two individuals who smoke, one gets sick and one doesn't. And I
Yes.
think that's really where the quality conversation can come from about, well, what do you need? I mean, we may not agree that smoking, I have my own views on fluoride, and I don't need to necessarily go into that
Right.
personally.
Right.
I think we just need to look at the health of the person. And so if I have a patient that's got thyroid problems or a young girl that's got polycystic ovary syndrome, which is on the rise, I know that's related to sometimes iodine problems.
Exactly.
So then
exactly.
maybe we talk to the patient about that.
So
and
maybe-
then let
maybe
them
they
be the judge of what they want to do.
Okay.
That's
great.
what I do.
So you're very big on educating people so they
Yeah.
understand perhaps the potential risk involved. For example, in this case, with fluoride exposure and how it might impact them if they have a
Right.
thyroid.
I mean,
or,
wouldn't you want that from your healthcare practitioner, that they talk to you and then you be the judge of what you want?
Amy, I think that's the best thing in the world. Always put it in the hands of the patient.
Yeah.
Agree completely. All right, folks. I can't believe this, Amy. This is not fair. Our show is halfway over with already. I'm Dr. Nelson Bulmash. You're listening to Health Matters, and my guest is Dr. Amy Daries. We'll be right back.
With all of life's stressors, it can be challenging to stay balanced and healthy. Hemp-derived cannabidiol, or CBD supplements such as Plus CBD oil, are becoming well recognized as a key supplement to optimize wellness. By working directly with our own internal system that maintains homeostasis, the endocannabinoid system, CBD, can help restore the body's natural rhythm when we need it the most. Learn more about Plus CBD oil and how to balance the system that balances you from www.pluscbdoil.com. That's www.pluscbdoil.com.
Hi there, I'm Dr. Amy Dayries, a general and integrative dentist in Roswell, Georgia, and I'm also a spokesperson for the American Dental Association. You know, as a dentist, I tell my patients that the mouth is the window to one's overall health, just as the eyes are the window to one's soul. After working in general dentistry for the last 25 years, it has become my desire to offer good health resource information to everyone around me, empowering members of the public to become their best, healthiest selves. The Whole Healing Radio Show features practitioners from dentistry, healthcare, and nutrition about the cutting-edge techniques available. Together, my guests and I will show you how to implement lifestyle changes, achieve your personal goals for health, and heal the parts of you that may have been forgotten. When your health is intact, you can go on to manifest your ultimate dreams. Become the best version of yourself. Join me, Dr. Amy Dayries, on the Whole Healing Radio Show to learn how.
Hi, folks. Dr. Nelson Bulmesh here, and you're listening to another episode of my show, Health Matters, and my guest is Dr. Amy Dayries. Before we continue, I want you to know that our show and many of the shows here are being sponsored by America's #1 choice for CBD products. So, Amy, after you. You want to take some?
I did right before the show. I'm
you're good. You're good. All right. I'm going to do it then. So we're talking about Plus CBD oil. So please support them. Mm-hmm. I'm going to use some right now. And Amy is going to begin discussing what we call the core of the snore. And I'm bringing this to her attention because all too often when I go on trips, my family says, Dad, really? You kept us up all night. So I'm going to ask Dr. Amy Dayries before you right now, Amy, what can we do to help reduce the snoring? And while you talk, I'm going to take a little pump, if you will, of this Plus CBD oil.
All right. Well, thank you. So I have a new book coming out in early June, and it may be called The Core of the Snore: Solving Sleep Disorders for Better Health. That's what it might be right now.
Okay.
And so we break down what good sleep looks like. I break down what good sleep looks like in the book. Then we go into herbal medicine techniques that have been used for literally many millennia, like using CBD oil or different other herbs, for instance, like ashwagandha or holy basil, and some of the other herbal remedies that have been used to help with sleep. And a lot of times there's sort of a personality of a person that might benefit from a certain herb. So it goes into those personalities in the book, or what I call personalities.
Sure.
So maybe you identify as the reader with one of those kind of people, and you realize that could help you. So going back to the title, The Core of the Snore, we have about a quarter of middle-aged women snore, middle-aged and up, and about 40 to 50% of men. And overall, as a nation, about 2 to 4% of us have a full-on sleep apnea issue. So the book goes into some of these statistics, how some of our modern lifestyle choices can contribute to why we don't sleep our best, and then what you can do about that. So either through like herbal medicine, or cutting inflammation through your diet, which often could, for some people, lead to something called metabolic syndrome or syndrome Z when it's accompanied with sleep apnea.
Right.
So getting your weight and your blood, your cholesterol numbers in a correct range, and how to look at that if you're the consumer, how to manipulate those numbers for yourself if you're the consumer.
Right, got it.
Also looking at different gene problems or hormone issues. For instance, about 40% of people that are hypothyroid have sleep apnea. So
that is a really interesting statistic.
So if you can treat 40% of patients that have hypothyroidism are found to have sleep apnea.
Wow. Do you know what the connection is?
It has to do with, again, these hormones. So maybe they have low certain vitamins or nutrients like iodine,
Right.
or their thyroid's just not functioning, and it could be from like adrenal failure from chronic stress, and therefore chronic fatigue.
Yeah.
So when you start activating or tapping down on the symptoms or the causes of this chronic
Sure.
fatigue, then a lot of times you just end up with better rest and ultimately, hopefully, solving the sleep apnea problem. So a lot of these patients that have been studied in certain medical studies who have had hypothyroidism, low functioning thyroid, once they got the thyroid functioning,
Yes.
their sleep apnea issue goes away. But it's being aware of these types of problems. We also go into, there's a number of oral appliances on the market because people might be wondering, what's a dentist doing talking about sleep?
Right.
Oral appliance therapy can sometimes remodel the airway. So if you have somebody that thought they were going to have to use a CPAP machine the rest of their life, with an oral appliance, it might take the place of using that CPAP appliance, or it can actually, in some cases, regenerate or remodel the airway, enlarge the airway.
Interesting. So when you use one of these appliances, is
Mhm.
that an appropriate term? An appliance?
Yes.
Yeah. Does it increase the aperture of the?
It increases volumetrically
Oh.
the size of the airway. So think about this. The teeth are located in front of the brain stem.
Yes.
And between the brain stem and the mouth is your esophagus and your airway.
Right.
So if you can grow the teeth in a forward, downward, outward sort of fashion,
You increase the volume
you
if
may
or
be
the
able to
aperture of the trachea
increase,
potentially.
potentially, yes.
Oh, okay.
So
Very
this
good.
is being done, this has been done over and over again. It's just that it's pretty cutting edge. So a lot of dentists haven't done these courses, they haven't done these types of appliances yet. And in our practice, I've been doing them for several years, and it's a growing thing, and it's a growing awareness with the public that these are even available.
Fantastic. Do you have, just out of curiosity, do you have any studies or any information about how you change through the use of your methods, whether it be herbs, whether it be changing diet, whether it
Yes.
be the applications for decreasing, for example, sleep apnea or snoring?
Yes. So there's a number of things that I've tried just about everything, to be honest
Yes.
with you. So for starters, if you're low on vitamin D,
Right.
you're not going to be able to get your good sleep. So you want to know your vitamin D levels.
Okay.
So I got mine where it's a lot more optimal.
Right. Good.
I have tried a number of the different herbs to try to sleep better. I was in adrenal failure a few years ago when I
Yes.
had this heavy metal load.
Right.
So in terms of getting well and getting some of these chemicals out of my body, and then supporting myself with like adaptogenic herbs,
Excellent.
like ashwagandha,
Right.
like getting my vitamin levels more
Idealized.
optimal.
Yeah.
Like and by the way, magnesium is another vitamin.
Critical.
Magnesium helps you absorb your vitamin D. So they say about 80% of Americans are low on magnesium.
Absolutely.
So if you take some of these over the counters, which really don't cost very much money at all, and the book goes into different things you can try over the counter. It's also something I talk with my patients about when they come in. Where are they with things? And then also looking at their hormone levels and sometimes these different gene SNPs. And gene SNPs are these small gene mutations that don't cause you to have something like Down syndrome, but these are upregulated through lifestyle choices.
Yes.
Maybe if you eat a diet that's got a lot of sugar or inflammation in it, you might turn on some of these where these genes have more of an importance.
Right.
And for instance, if you have, for example, like mother-father gene, MTHFR, and there's a number of manifestations of that gene, but you can't detox things as well. So if you're the girl that likes to be a party girl and you have too much to drink, your liver's not going to be able to detox that alcohol.
Right.
And you're going to slow down your whole metabolism. You're not going to be able to get rid of viruses as quickly as well. You're more likely to get sick longer. You're more likely to end up having cardiovascular problems, diabetes types of problems, which is going to set you up to have
All
more
kinds of
problems
diseases.
like metabolic
Right.
syndrome or syndrome
Yes.
X or Z. That's going to lead to the road to sleep apnea.
Right.
So it's having a full appreciation for all these parts about how your body is going to work like a complicated machine. And I would recommend you have guidance with these things.
Yeah. They can get complicated.
Right. And putting all these things together and then maybe also supporting a patient with an oral device. So we do like take home sleep testing.
Mhm.
As a dentist, I don't diagnose sleep apnea. I have a physician read that.
Right.
But we can send somebody home with a take home sleep test that they wear in the comfort of their own bed for not very much money, and we can give them a pretty good rundown on how they're really sleeping and what they are doing. And so also, we got to look at what is really going on.
This is so exciting. So you can do many of these things, and I'm sure
Mm-hmm.
you don't probably just do one, but you advocate many things.
Right.
The use of the herbs, the alteration of the diet, probably exercise
Yep.
is very, very important. Maybe relaxation techniques and other
Yes,
things.
those too.
Yeah,
And these
and-
salivary tests, these gene snips can be done with a salivary test.
Okay. And
So-
so you actually get a
A whole
potential-
picture,
a whole
of
picture
what the person's doing,
Right.
and then you can help them put together a stepwise plan. And they can maybe do the easy, cheap stuff first, like if magnesium's
Right.
$6 for the bottle,
Yeah.
or an old appliance might go into a lot more money, but there may also be some coverage with medical or dental insurance if you're helping with a
Sure.
a
This is-
diagnosed sleep problem.
This is so interesting, Amy, because all the evidence that I've seen indicates that people who have sleep apnea, if it's unchecked, potentially are going to have problems that not only decrease the quality of their lives, but can decrease
The length.
the length of their
Yeah,
life. which-
statistically, that would take you
Yes.
from about an 80-year lifespan to 65 years, just right there if it's never treated.
wow, that's a huge percentage decrease.
Yep.
Okay, interesting. Wow. I'm a little shocked. I have trouble with both of those, so I'm on it, Amy. I'm on
Okay,
it.
so yeah,
Get that
if
book
you're
out,
getting
Amy.
if you're getting told out there that you're snoring, you might want to figure out why you're snoring.
Right.
Is it you're just snoring, or is there a closed airway, a crimped airway? You're breathing through like a coffee straw instead of a garden hose sort of problem.
Mhm.
And with our modern dental techniques too, a lot of times the dentist is the first person to start noticing there's a problem. A lot of our snoring people are grinding their teeth.
Yes.
And so now there's take-home sleep monitors that can measure if they really are grinding, because people are like, no, I don't think I do that. I'm snoring. How could I be grinding my teeth if I'm snoring?
Right, right.
Because you're going to be fluctuating through different phases of sleep.
Got it.
So you want to know, anyway, the book goes into like what does good sleep look like and what happens when you're sleeping, what's supposed to happen, and then what can a sleep test show to reflect what you're doing, what your special sauce
Right.
is when you go to sleep. And then that helps us tell what to do about how to fix you, hopefully.
Amy, I want to talk about another a topic that's
Sure.
very near and dear to me. You know where I'm going with this?
I really don't.
Peptides.
Oh, let's talk
Let's
about
talk about
peptides.
peptides.
Oh, so there's this one peptide. I'm so impressed with it's really the main one I know about.
Right.
So I know you, Dr. Bolmash, use a lot of peptides with your patients. And the only one I've really, up until only about 6 months ago, actually, I heard about BPC 157, and it's been studied for periodontal disease. And there was a study. I know people are always like, we're so not like rats, but we are like rats in a lot of ways.
In a lot of ways.
In a lot of ways. So
Some more than others, by the way.
yeah, in this study on rats,
Right.
they tied I guess it was dental floss or a wire, a ligature around various teeth in two different sets of rats. And the ones that had this peptide,
Yes.
BPC 157, they did not get gum disease within a few weeks. Where the other ones,
Wow.
the BPC 157 apparently highly suppresses inflammation. So the ones that did not have the BPC 157, who had these same ligature wires tied around these teeth, they all had severe gum disease very, very quickly. So it can be put into like a toothpaste,
Right.
or you can take it as a supplement. So that's the main one I know about, and so it's crazy, amazing.
Fantastic.
That's not the only study, but that's the main one
Right.
I remember about.
Well, the idea is that it can greatly decrease the effects, certainly, of gum disease and other oral problems that greatly.
So cool.
Yeah, I love this. Don't get me started on peptides. I can go forever and ever and ever.
Well, you brought it up.
No, I know. I love it. I just
Okay.
love it. All right. So I want to talk real quickly because we only have a minute before our next commercial break. You have a
Okay.
show coming up this Thursday. Give us
Yes.
the details.
Oh my! I have. We're going to be talking. My show is on. It's called the Whole Healing Radio Show. It's oftentimes dental topics, but this Thursday I have a very special guest, John Souders, coming on, and he is a peer of mine. I've known him since I was in my early 20s, and he retired at the age of 40 to pursue all kinds of lifelong loves that he
Love it.
has. And so he's going to be talking about financial health, which is very different, totally different. We usually talk about physical or emotional or spiritual
Right.
health on my show, but this one's going to be financial health, because that is going to feed your spiritual, emotional,
Right. Get it.
and,
Good
and
point.
physical health.
And it's on at 6 p.m. Eastern Standard Time this Thursday on all the same stations and platforms.
That's right.
Yes.
So I hope to see, or maybe y'all will tune in, some of you.
Absolutely. Definitely. Thank you, Amy. Dr. Nelson Bulmash here. You're listening to Health Matters, and my guest is Dr. Amy Dairies. We're looking at the connection of the mouth to your health and the quality of your life and longevity. We'll be right back.
Hi, my name is Susan.
And my name is Megan.
And we're the hosts of The Awakening Educator, a show about education, its policies, and the issues most relevant in our schools.
We take you inside contemporary issues to understand them from different points of view and highlight the achievements and best practices of the people who serve our students.
I'm a licensed marriage family therapist with over 25 years of experience working with children, families, schools, and communities to improve health and academic outcomes.
And I'm a systems thinker with a doctoral degree in educational leadership with over 25 years of experience as a teacher, school leader, and district administrator.
Together, we plan to take the educational system by storm using our personal experiences and knowledge to help those interested in a brighter future for education.
You can listen to our show every other Friday at 4 p.m. Eastern Standard Time on WDJY 99.1 FM, WTTA 101.2, Talk 10 FM, Facebook Live, and Spreaker at United Intentions.
You can also catch us at uimediaapp.com anytime, anywhere in the world.
So grab a pen and paper and take notes.
We're going to change the way you think about education on The Awakening Educator.
Hello, everyone, and thank you for tuning in. I'm Dr. Nelson Bulmash. You're listening to Health Matters, and my guest today is Dr. Amy Dairies, and we're exploring the connection between your oral hygiene and your quality of life and your life expectancy. And Amy, we got a question in here. Do you want to read it to the folks? And
Sure. It
take
says,
it. It's from Dr. Jeff Arnell from New York.
other than dietary changes, have there been any studies done to show if and how physical exercise, specifically cardio, may affect bad oral bacteria levels? So I haven't seen a specific test or study done on bad bacteria and exercise. But what we do know is the way you're going to process insulin is going to be improved if you're exercising,
Right.
specifically with cardio. Also, it's recommended you really do a mix of different types of exercises, not just all cardio. You
Yep.
need to do other types of exercises really to create your best resilience, physical resilience. But I can say that if you're breathing through your mouth, you really want to be mindful of how you're breathing when you're exercising, because that is going to right there change the volume of air you're intaking.
Yes.
They say that when you're breathing through your mouth, you're going to inhale and exhale sort of like too much. And so that's going to change potentially the ratios of carbon dioxide to oxygen
Okay.
in your body.
Right.
So there's a really good book out there. It's got by Patrick McCowan called Close Your Mouth. He goes into this, and this is why, talking about breathing through your mouth when you're exercising, why it's so good a lot of times for like an asthmatic to take up swimming as a sport, because that gives them a rhythmic breathing rate where they have to
got it.
they don't have so long to breathe through their mouth.
Yes.
But it's helping you to self-regulate how much volume you're intaking.
Right.
Because the whole thing is when you take in or hold on, if you're exhaling through your mouth and inhaling through your mouth, you're holding on to less than 6% carbon dioxide. And 6% is apparently kind of the critical amount that you need so that you keep your nasal passages open. So
Got it.
when you're breathing through your mouth so much and you have an underabundance of carbon dioxide, see, because we're supposed to exhale carbon dioxide, but we have to have a critical amount. And when we don't have at least 6% always ever present in our bloodstream and in our cells, our our body's response is it clogs up your nose. So
very interesting.
There was a Dr. Butaiko. He was a Ukrainian doctor, practiced, I think, up until like the 1960s, and his whole thesis and work was all about Butaiko breathing. where he was training people to be mindful of breathing through, inhaling and exhaling through their nose. So more and more, you'll see personal trainers becoming aware of not just breathing out through your mouth, but actually inhaling and exhaling through your nose. So something to think about. And you might have something to say about that with all of your health
Well,
background.
I'm in a bit of a quandary. I get the idea. I like it. Where I go with this is in sports where you're doing bursts, where it's really hard to get enough oxygen in through your nose. For example, when I'm doing, let's say I take a pair of 130-pound dumbbells and I'm pressing them to failure, it's what gets difficult is I've tried to breathe through my nose. It's really hard to get enough oxygen in, in the last few reps. So I'd be interested in speaking to him or somebody about how to modulate that. So,
well, he's passed, but
well, maybe he has followers
but
or somebody.
He definitely
or reading
has.
his book,
Yeah,
maybe.
there's a lot. Well, Patrick McCown's around, but Dr. Bataika, who pioneered this work. But maybe you're also talking about sort of in the final stages of your workout or certain parts of your workout, but just overall, and then a lot of types of exercises you probably could, be mindful of breathing through your nose.
Yeah. Interesting. Very, very, very interesting. Jeff, thank you for that. I appreciate, Doctor, you listening and your great question. I have a question, speaking of exercise.
Okay.
Amy, how, if at all, does the appliance worn over time influence one's recovery, particularly with exercise? Does it
You're
make a
talking
difference?
about oral appliances that you would potentially wear while sleeping?
Yes.
And maybe a few hours in the evening
Yes.
to help with this remodeling process. And there are other types of, there's a number of different appliances out there. So some might be 24/7. You might have traditional orthodontics, for example, that could be 24/7.
Okay.
But, as you're, some of these functional appliances that we're talking about,
Right.
you're actually growing and remodeling the airway space. It's actually becoming larger. That's what
And is
research
this
is
permanent,
showing.
by the way?
Yes, it is.
Oh, okay.
They do still recommend that for at least the first few years after you've had it, that you remind the tissue this is where we want you to be.
Yes.
Because sometimes there will have been an underlying causative factor that might have contributed to the airway never fully manifesting to begin with.
Yeah.
Like
Got
a
it.
tongue thrust, like a downward forward tongue position. But these appliances a lot of times will actually draw attention to the roof of the mouth where the tongue, and it's actually flattened and broadened the palate. So it's easier for a lot of people to get their tongue fully engaged in the roof of their mouth.
Got it.
Which is going to downgrade their sympathetic nervous system. See, the tongue's the second muscle to develop after your heart. I know I'm kind of going all over the place here a little bit.
No, I'm following. I'm following you.
So when your tongue is in a downward position, it's stimulating the vagus nerve on a low grade level.
Okay.
So people that have a downward tongue thrust, they also tend to mouth breathe a little bit more often because their palate never fully has developed and their sympathetic nervous system's engaged a little bit. So they are usually higher anxiety.
Yes.
And they don't have the heart rate variability is what medical research is showing, that somebody who is able to engage their tongue in the roof of their mouth. So,
well, that's interesting because that can make a very profound difference, in other words, in the quality of your health.
Yeah.
These things, because you're staying activated, in other words, probably from a mild to a moderate degree of sympathetic overwhelm. So you're going to drive your adrenal glands that help you to handle stress, and they're going to keep you in an outpouring of anything from energy to nutrients to oxygen. So you're going to use yourself up faster, and you're going to stay a lot more stressed throughout the duration of your life.
And not ever even realize that you were having to do that.
Isn't that interesting? Yeah, not even aware.
You're compensating without realizing it.
So give us what I call some tips, some interesting tips about how to really keep your oral cavity, your mouth, healthy.
Okay.
For a long, long time, because I really,
Practice.
You have an amazing smile, and I noticed that about you. So you obviously take great care of your teeth. How do I keep my teeth for the rest of my life, Amy?
Pay attention to what you eat.
Okay.
You are what you eat. You're going to cut down your inflammation. You're going to practice good oral hygiene by brushing, and I still say flossing, although some people out there say you don't need to floss.
Okay.
I think that's
You're
craziness.
pro flossing.
You got to floss. Oh, absolutely.
Okay.
Be mindful of the chemicals you're putting in your mouth and in your body.
Did we
overall.
agree that it was no mouthwash?
I'm not a huge fan of mouthwash unless you have a really special date.
Oh, okay. Okay.
Or
We don't
maybe
want to
for
ruin
the
a date.
short run. Maybe for the short run because you just had, I don't know, a whole bunch of
procedure
garlic
done,
or
maybe?
something, or you had a procedure and you're needing to do it because you just had a gum procedure. So you're rinsing for a couple of weeks.
Right.
but then you need to like be able to graduate from that mouthwash. When you're having to rely on so many chemicals, there's something going on where you're not in a state of equilibrium, where you're not giving
Very good
yourself
point.
what you need.
Yeah.
So I want you to also focus on breathing through your mouth. If you're tongue tied and you can't put your tongue in the roof of your mouth, maybe talk to your practitioner about, do I need to do something here, or am I just fine anyway? I've had people that were severely tongue tied. Once we clip that, they have more endurance when they go work out.
That makes a lot of
Things
sense.
like that.
Yeah, your
It's
recovery,
pretty
if nothing
amazing.
else, would be much better.
Yeah. We already talked about diet.
I have one. Here's
resting.
another one.
Sure.
What do you think about irrigating your gum line, even with just salt water daily? Is that something
I think that's potentially very helpful. So some people would also advocate something like a water pick with maybe a little bit of hydrogen peroxide or a little bit of baking soda in the water pick that can act as a chemical buffer, a very gentle chemical buffer. It's also not which toothbrush or which brand of toothpaste you use. It's what you're doing with it.
Yeah, got it.
So
talk about that for a second. I didn't realize until a year ago that it was so critical. Nobody ever sat me down like when I was in a dental chair and said, "Here's how I want you to brush." How do you brush? What's
so
the way to
you
brush?
want to focus where about half the bristles are on the gum, at the gum line, and the other half are on the teeth. So really you want that toothbrush to really meet that junction of gum to tooth place, because that's where the teeth have what we call a height of contour, where they're the bumpiest, or they bow out the most, and then they actually taper in right at the gum line. And so where do the bacteria like to sit on the teeth? They like to sit right on that gum line junction.
Makes sense.
Because there's less activity, there's less action.
Right.
It's like where sludgy stuff will collect.
Ouch.
So that's where you want to focus on brushing. How you do it with exactly what chemicals you want to use, I'd say that's up to the consumer.
Okay, couple more questions here. Vertical brushing, circular brushing?
Okay, so there's discrepancies. I would say just generally speaking, circular brushing.
Okay.
If you have a lot of recession or you have rear to the tooth showing, you want to probably use more of an upward stroke or a downward stroke, or more of a vertical stroke rather than a horizontal stroke. It's really, there's also been a lot of controversy about bristles and how hard bristles ought to be.
Right.
And so just generally a soft bristled toothbrush, it's frankly hard to find something other than that on the market these days.
Okay.
Electric toothbrushes are great. Again, it's not which one you have, but what you're doing with it. I do think electric toothbrushes work really well for people that have maybe limited dexterity, or they just
good point.
really don't want to have to think about a lot of things.
Right. Let the toothbrush do the work.
Right. So those are good. Those are all good tools.
Excellent.
Those are good tools.
Amy, two things. Unfortunately, we're coming to a close here. Any final thoughts for the listening and viewing audience?
I really hope that the public will really start to appreciate more that going to the dentist generally can be affordable for a preventative type of appointment.
Yes.
You might find out a whole lot about the rest of your health at the dentist. Also at the dentist, you can see the same dentist, generally speaking, year after year, month after month, where a lot of times with the way and the expense of our medical system, your doctor may shift because your insurance shifts.
Right.
So it's really great to generate a relationship with somebody like a dentist where you can get affordable care where you're going to learn all about yourself, where it's not going to cost $1 million, and where you have consistency with your provider.
Quickly tell everybody how they can get a hold of you. How can they reach out to you?
So I'm in the Roswell area, 770-753-0067. I have a website that features some of my radio shows and some blog stuff, and that is wholehealingdental.com. And my radio show is here on the United Intentions Media Network on Thursday nights, alternating Thursdays at 6 o'clock Eastern Standard Time. Office is in Roswell, and my dental partner is Dr. Victoria Calicut. We're off of Upper Henry Road near North Fulton Hospital. Thanks so much for having me on tonight.
You are very, very welcome, folks. This is Dr. Nelson Bulmash. Join me in 2 weeks as I interview Carrie Davis, who is up for many awards for her documentary against poaching. Join me then at 5 p.m. Eastern Standard Time. Take great care. Be your best until then.
Thank you for joining us on this edition of Health Matters with Dr. Nelson Bulmash, where we help you discover how to ignite your mind, body, and spirit connection. Join us next time when we will bring you more exciting guests and engaging topics. Meanwhile, feed your mind, exercise your body, and nurture your spirit. The United Intentions Foundation and its associates take no responsibility for the opinions and statements made by the talk show hosts or their guests.